Jeff Slauson here from 19 News Now at the 19 News Digital Desk. This is something that we've been covering for a couple of months now, with this flu season in particular, seeing some fairly large numbers considering where we've been the past couple of years. Today, Ohio Department of Health reporting the first pediatric flu-related death of this 2024-2025 season. Obviously awful news, and pointing to where we are right now with this flu season. And again, as I'm saying, kind of this larger trend. When we have situations like this, we got to bring in the experts, people that understand what they're talking about. That is why we are so grateful and thankful to have Dr. Donald Dumford with the Cleveland Clinic joining us today. Doctor, this is obviously horrible news. The numbers that we have been seeing here, break down for people why we are seeing the numbers that we are seeing, where, I mean, just much, much larger than some areas that we saw the last couple.
And thanks for having me today. You're right. It's just a really terrible flu season, and really one of the worst we've seen, or if not the worst, in about the past 15 years. There's I think a few different things that go into this. One is that we're seeing quite a bit of the H3N2 form of flu, which is typically known to cause more severe disease than the H1N1. So those are the two big types that are going around. So if you've got more of the more severe virus floating around, you're going to see more severe cases, more spread of illness. I think the other thing too is that we are seeing that flu vaccination rates have been dropping pretty significantly. If you look this year compared to several years ago, we administered about 30 million less flu vaccines this year than we had in previous years. We're probably somewhere between 35 to 40% of the population that's eligible having gotten the vaccine. And while we know that flu vaccines don't necessarily prevent every single case of the flu, if you do happen to get the flu after having been vaccinated, you will get less severe illness. So I think that's particularly important when we're seeing high rates of the flu. Probably the other thing, and I hate to say it because it's brought up in every health topic these days, is thinking about the pandemic and COVID. But we saw a lot less flu during COVID because the measures we were taking between social distancing and with masking. And really that means that we weren't exposed as much to the flu as a population, which means there's more people that are susceptible at this point. So take that plus the lower vaccination rates. I think that's why we're seeing this really bad flu season this year.
And I understand, you're dead on. We always, I feel like, do compare things back to the pandemic, but I think what you said there is very important, right? Putting the data in perspective as far as where we are right now. So when we do look at the charts and we see, at least for the state data, I mean, that shows a massive jump up there. Do we take that as very much so concern? Do we take that as that's just the way that this year is? I mean, how should we perceive that as far as kind of getting the holistic approach from this year?
No, sure. I think that when all's said and done, and we kind of, it's always the Monday morning quarterback when we try and figure things out at the end of a flu season. I think when all's said and done, we're going to see that this is probably an aberrancy. I don't think that next year we're going to see a flu season like this year. And I think that's probably because a lot of us have ended up getting exposed. So I think though that as we go forward, we have to say, wow, the flu seasons can be really bad. We can see a lot of people having really severe illness. In our hospitals, we're seeing a lot of patients that are hospitalized right now. About 1 out of every 6 or 7 of our patients is hospitalized with the flu at the Cleveland Clinic hospitals. I think as we go forward, then we have to say, well, what can we do differently? And I think really the main thing is doing the common sense things, and that main common sense thing is working to increase the amount of people who are getting flu vaccines, because it's really our best way as a population to help to mitigate this. When you get a vaccine, you're not just preventing the infection in you might be preventing that elderly family member, that immunocompromised friend, the kid at home from getting the flu and potentially having a really severe case.
Again, speaking with Dr. Donald Dumford with the Cleveland Clinic here, you mentioned the amount of vaccinations that we are currently seeing. We always talk about vaccinations. We've talked to multiple people at the Cleveland Clinic, probably spoken to you over the last 4 years about this as well. Are we noticing some sort of a fatigue with vaccines, with people getting vaccinations? Has that been something that's been kind of tracking up to this point?
I think so. And I think with flu vaccines, actually, we've seen a slight difference in that COVID originally caused more people to get vaccinated. And then now we're seeing, I think that, kind of that fatigue. And now we're down to probably our lowest level of vaccination, that we've seen in the past, probably past 10 years. Before this, the time when we saw people get, the kind of low number was back in 2017, 2018, which actually was also a particularly bad flu season, not nearly as bad as this one. But I think we're seeing that, for the past few years, we're just seeing those numbers decline each year. And I think it really is, there is fatigue out there. I think people are tired of being told to get jabbed in the arm. But it's important for us to keep telling people to get jabbed in the arm to protect them and their family and friends.
Right. I mean, because it's important to think about. It's not just you that you're protecting. It could potentially also be the vulnerable population. Looking at the data today, the 60 to 69 age group is leading by far with those hospitalizations. Then obviously the ones that are in those older age groups from there are filtering out. But I did find it interesting that the 0 to 19 also was seeing quite a bit as well. We expect the older population to be getting sick from things like this. I feel like a lot of people don't necessarily expect the younger population to be getting sick as well. Can you talk about the vulnerability of those that are in the teens and younger age group?
Oh, sure, yeah. And I think, normally when we see those severe cases in those younger populations, I guess I'll start back a second. The older populations typically have one, an old immune system that doesn't work quite as well. They have other medical problems, lung disease, heart disease, all the things that are going to get exacerbated when they get infected. I think, those really severe cases we're seeing in the younger populations, one would be some of those people that do have some sort of other illness. I think two, those really severe cases are the ones where there's a bacterial infection, hopping on top of the flu vaccine. Essentially, the problem is when you get the flu vaccine, or sorry, I said vaccine twice, I should. When you get the flu virus, is that you're really causing, irritation to the airways. And when you break down that normal barrier there, that's going to make you more susceptible to other infections. And particularly when you see, bacterial pneumonia, you're typically talking about staph infections and strep infections. At least when I see people in the hospital, I don't take care of those 14 to 19-year-olds, but when I see a 20 to 35-year-old in the hospital with the flu and they're looking really sick and it's really severe, it's typically because they've got one of those bacterial pneumonias that have then complicated the flu.
Doctor, you've answered all of my questions. We really do appreciate the time, like I said. Is there anything specifically that we didn't mention that we should have, or anything that you would hope that the people know that are watching this as we head into the later half, hopefully, of this flu season?
Sure, yeah. In a normal flu season, if it was, February 21st and people were asking me, what they should be doing, I'd probably be like, well, it might be too late to get a flu vaccine. But with the fact that we're just now probably hitting our peak, or maybe not have hit our peak yet for our flu season, for those people out there that haven't gotten vaccinated, I'd recommend to go out today and get a vaccine. It's gonna reduce. It's either going to prevent your illness, reduce the illness you do have, protect those around you. When you talk about other things to do, I think especially if you're one of those vulnerable populations, say other pre-existing health conditions, elderly population, as soon as you get a fever, you're gonna, typically flu is going to be fever, sore throat, cough, and those muscle aches. As soon as you get that fever and you start to think it could be the flu, I'd call your primary care doc, because if they might be able to get you a medicine like Tamiflu that's going to further mitigate the severity. I think the other thing too right now is, I always like to reiterate to people that when you are sick, you have to take care of those around you. So, whether it's you think you got the flu, you think you got COVID, I think when you are sick and coughing and have a fever, it's really important to take yourself out of circulation, stay home from school, stay home from work. And, if you do have to go out, or even the few days days after you're feeling better and you're out and about, I really encourage people to wear a mask at that point to protect those around them.
Dr. Donald Umford with the Cleveland Clinic, we are so appreciative of your time. Thank you so much for joining us today. Yeah, a lot of great insight, and let's hope that we are at our peak and that we can start seeing the numbers go down so you and I don't have to have this conversation again. We can have a different one about a different topic. But yeah, thank you so much for your time today. We really appreciate it.
Yeah, thanks for having me. Have a great day.
And of course, we have all of this information available on our website, cleveland19.com. So if you want to head over to there right now, you can find every link. For now, I'm Jeff Slauson with 19 News. Have a great day and a great night. Much more to come, both on air and online.
19 News, now streaming on Samsung Smart TV. Search for channel 1035.
Really, really, really great, Doctor. Thank you so much for your time today. That was beyond perfect for what we needed. So yeah, thank you. Really, really appreciate it.
Oh, thanks a lot. Thanks for having me, Jeff. Have a
And
great day.
if there's any questions on how to find it or anything, I can send a link over. But yeah, again, have a great weekend and thank you so much.
All right, thanks. Have a great weekend.
Yeah, you as well. Bye-bye.